A very beautiful morning, beautiful afternoon, and beautiful evening to every one of you, my professional colleagues. How we are doing? Great nurses, articulated nurses, wonderful nurses. I know we are all doing well. How is preparations going? A lot of people are writing this month. How are you preparing? I just want to let you know you're definitely going to succeed. Keep up the good work. Keep practicing. Check out a lot of my videos on intramuscular injection, subcutaneous injection, end of life, assessments. You know, you're definitely going to pass, and I'm definitely going to congratulate you. It's a very, very simple exam. And that reminds me, a big shout out to those who recently took their Osce exam. You know, I'm baffled, honestly. I'm excited. In fact, excitement is an understatement, I must say. Even people I least expected. A lot of people are like, I've never commented on your videos, but I just want to say to you, thank you. You're doing a good job. I passed my Osce on first attempt. You know what? And nurses are very brilliant. I'm so proud of every one of you who has passed your Osce exam, and I celebrate with you. And I like to let you know you're definitely going to be successful if you're preparing for your Osce exam. All right, so we've started our series on 5-day study with me. I've done lecture series 1. Lecture series 2 video is actually ready. I'll try and upload it. But because of our nurses who are taking the new test of competency, a lot of them have been on me like, can you do assessment? Can you do critical, you know, appraiser? Can you do this? Can you do that? I'm more than happy to do all the videos. It's just because of time limits, to be honest. It's just time. I'm more than happy. They are all simple stations. And so for the new Osce, you're writing 10 stations. You're writing them in pairs after your assessment, plan, implementation, and evaluation, and you'll be having them in pairs. Okay, so today I'll be doing assessment, A to E assessment, and I'll be giving you an assignment. I'll be giving you your own case scenario that I want you to try your hands on. So I'll be doing my own assessment today. So I want you to watch me. It's an A to E assessment. So I would advise, after doing the airway, you know, when you're talking to the patient is responsive to you. So, you know, the airway is clear, obviously. When you get to B, which is the breathing, I advise you to use that medium to do all your observations. If you don't understand how it works, don't worry. Keep watching, stay tuned, and you see how I do mine, and you have better understanding. All right, guys. So if you're watching me for the first time, my name is Violet Okolocha. I'm a nurse practicing here in the UK. I actually talk about everything about Osce and nursing here in the UK. So if this is what you want and what you like, just stay tuned. All right, so guys, I'll be doing a scenario today on a patient who has been diagnosed with appendicitis. This patient does not smoke, this patient does not drink, this patient has no allergy, and this patient is actually going for appendectomy surgery. So I'll be doing a video on that today, so watch out. And you know, feel free to ask any question. If you have any question on this skill or any of the station, feel free to ask any question, and I'll be more than happy to answer your questions. And if you're writing the new Osce and you're bothered about anything, feel free to add me on your Facebook. My Facebook name is Violet Okolocha. Just send me a friend request. Once I see your friend request, I scroll through. I usually know my Osce student because through their profile, I'm always able to know their nurses and something like that. So I'll immediately accept. And especially if you're writing the new Osce and you're confused about one thing or the other, because I really want all of you to excel and pass your Osce exam in one setting, just, you know, Facebook me, okay? All right, guys, so come with me, guys, and let's get started. Let's simplify this skill. This skill is just 20 minutes. Sorry, the assessment is 20 minutes. In the old Osce, the assessment is 15 minutes, and you have complete 5 minutes to read your scenario. But in this new test of competency, no 5 minutes to read any scenario. Everything about the assessment is 20 minutes. So as you go there, you see your scenario, your time has started. Maybe your assessor tells you you're starting with assessment, blah, blah, blah. Your time starts. So you just have to try as much as possible to meet up with the time. But trust me, you'll finish before 17 minutes. I bet you. When I told a lot of people who took the new test, you finish with this, oh, I'm scared. And they all passed. You know what I mean? So you'll finish definitely before time. So just try and just watch this video and see the little tips. You know, if you watch doing this video, doing my breathing, I use it in doing all my assessment, calculate my new score, you know, you just get some logic. All right, so I wish you a success in your Osce exam. Keep soaring, keep passing, and come with me. Let's practicalize this skill on A to E assessments. Let's get started. I approach my scene. I see my scene is safe to approach. I provide privacy for my patients. Then I do my hand hygiene according to the WHO method. Palm to palm. Right palm over left dorsum, vice versa, fingers interlaced, Fingers interlocked, rotation of the form, tips to the finger, and my wrist. So my hands are clean. I go ahead and approach my patient. Hello.
Hi.
My name is Violet, and I'm one of the nurses looking after you today. Can I please confirm your full name and date of birth with you, please?
My name is Helen.
And your date of birth, please?
7th May 1940.
And can I double check that with your wristband?
Okay.
I have here Haley Brook, date of birth 7th May 1940, hospital number 10010. Assessor, with the paperwork on my hand, I can confirm I have the right patient. Haley, can I double check with you? Do you have any allergies at all to food, drug, latex, or adhesive, please?
No, I don't.
You have no allergy. That's perfect. So Haley, the reason I'm here this morning is because I want to assess you. We want to carry out an A to E assessment on you. Is this a convenient time?
Yes.
Are you happy for us to go ahead?
Yes, of course.
All right, lovely. So because you are talking to me, because the H is for airway, because you're talking to me, I can see there is no obstruction. You're very responsive. So obviously your airway is clear. Is that all right?
Yes.
So I'll move over to the breathing. All right. So for the breathing, I'm going to be doing a general assessment on you. I'm going to be doing your observation. I'll check your blood pressure. I'll check your pulse, your respiration. Are you happy for me to go ahead?
Yes.
All right. Can I just confirm with you? Have you ever had surgery in your left hand?
No.
You've never had surgery in your left hand, because I can see your left hand and I see your left hand. There is no inflammation. You know, there is no edema. I'm more than happy to use your left hand if that's all right. All right.
Yes.
So I'll just put on my apron. And I'll put on my glove. So guys, everything about your equipment to use is already set up for you on the table. So if you want to double check, you can just, as assessor, can you confirm my equipment is clean and ready for use? And he or she is going to tell you yes. So put on your apron, put on your glove. I would advise strictly put on your apron and your glove when carrying out your observations. So I'll be tying the cuff 2 to 3 centimeters away from your cubital fossa. But in this case, what I have is for the wrist. So obviously, I can't use that one for the wrist. So I'll be tying the cuff 2 to 3 centimeters away from your cubital fossa. So I'll tie this on. It's raised because it won't go there. This is for the wrist. And I'll start. You may feel some tightness, but don't let that bother you, right? It's just for a while, right?
Okay.
So let's take your blood pressure quickly. So guys, for this station, you may get a live patient. Recently, a lot of people have gotten live patient for their assessment in the new test of competency and in the old test of competency. So if you get a mannequin, no worries. All the assessment scores will be given to you, like the respiration temperature will be given to you. But if you get a live patient, you have to do it yourself. All right, now the blood pressure has read and it's 128/78. So this is my news chart. Haley Brook, write the patient name, write the patient date of birth, write the dates, and write the time. So the blood pressure is 128/78. Chart correctly, that's what I would advise. 128/78. Perfect. So I've done the blood pressure 128/78. And please, if you are carrying out this skill with a live patient, don't take the pulse here. Count your pulse manually. All right, I'm just going to be counting your pulse for 2 minutes. Is that all right? Okay. I'm just going to be putting my 2 hands, sorry my love, on your radial artery, and I'll count for complete 2 minutes. Are you happy with that? Okay. All right. All right, Mrs. Ailey, I'm done. So for your pulse is slightly elevated, all right?
Okay.
And that's because, I think it's because you are having probably an ongoing infection. So your pulse is slightly elevated, just slightly. I got 92. And I did count your respiration as well. So your respiration is 20. I didn't want to obstruct the reading, so I counted your pulse for 1 minute and I counted your respiration for 1 minute. Is that all right? So can I check with you your ears? Do you have any discharges from your ears?
No.
All right. Can I double check that with you? All right. I can see there is no discharge from the ear. I'm more than happy. So I'm just going to be taking your temperature. Is that all right?
Okay.
So sorry, darling. Okay, I put this straight into the clinical waist. Your temperature is also quite elevated and it's 38.1, I'm afraid. I go over 38.1, that's it. Okay, 38.1. Can I quickly do a capillary refill? Can I have your fingers, please? All right, I see your neighbors. I can see there is no cyanosis. It's properly perfused. I'll just do a capillary refill quickly. I'll do it for 5 seconds. I see it's less than 2 seconds. All right, I'll put a probe. So I don't have the probe, but just assume I'm putting the probe just to take your saturation level. All right, okay. Lovely. So your saturation level is... Definitely, guys, remember to use scale 1. Your saturation level is 96 and I'm using scale 1. And because you are talking to me clearly, are you on any oxygen?
No.
Yeah, you're talking to me clearly, so you're on air. So I'm just going to be totaling your score now. So because your temperature is 38.1 and your heart rate is 92, that gives me a score of 2. Don't cram anything, it's all over. A score of 2 is 4 to 6 hourly. Escalation of care, yes, and I put my signature. I take away my apron. I take away my glove. All goes in the clinical waste. And I do my hand hygiene. All right, Mrs. Ailey, I've done all your observations. So for the breathing, actually, I see you're not breathing with the use of your accessory muscles. There is no unequal entering of air. There is no visual sign of respiratory distress. Your respiration is all right, and I'm happy with that. There is no wheezing. There is no coughing. There is no stridor. So I'm more than happy with your respiration, all right? Or do you feel you're breathing with any form of distress? Are you breathing because there's no visual sound of respiratory distress? Or are you breathing with any distress?
No.
Okay, so I'm more than happy with the breathing, all right? Okay. So for your circulation, I did your pulse, and I counted your pulse for complete 1 minute. And your heart rate is all right. The strength of your heart rate is all right. I checked your neighbors and you were not cyanosis. There is no visual sign of cyanosis. So I'm more than happy with that, all right? Okay. So I did a capillary refill. You saw I did a capillary refill for 5 seconds and it was less than 2 seconds, okay? So I'm not bothered about that. And you are not paid, all right? Okay. So I'll move over to your disability. Can I just quickly ask you, do you know where you are at the moment?
Yes, I'm at the hospital.
You are at the hospital, bless you. And do you know what brought you to the hospital?
Because I'm having abdominal pain.
Oh, you're having abdominal pain. Have the doctors assessed you? Did they do any scan for you?
Yeah, they did scan and they said I have appendicitis.
Oh, sorry. Do you mind being a bit audible?
I said I have appendicitis.
Oh, that's what the doctor said to you. So how long have you been having this pain for? The abdominal pain. How long has it been for?
For 2 days now.
For 2 days. Can you walk with the abdominal pain?
No, it's not. I cannot work with it. It's very severe right now.
Wow. So if I ask you to score your pain, 0 being the least pain you've ever had and 10 being the highest pain, what would you score, my love?
Probably a 7.
A 7. That's quite high. Yeah. Bless you. So you can't mobilize at the moment.
No.
Have you been toileting effectively? Have you been going to the toilet well?
No, for the past 5 days now, I've not gone to the toilet.
Wow, that means you are constipated.
Yes.
Well, you know what appendicitis is?
No, I don't really
It's actually an inflammation of the appendix. So that's why you're having abdominal pain. Did the doctors do a scan? Did they do a scan on you?
Yeah, they did scan.
Oh, and that's how they confirm you're having appendicitis.
Yes.
So what did they say they want to do for you? Are you aware?
Yeah, they say I'm going for a surgery.
Oh, you're going for a surgery.
Yes.
All right. So to be honest with you, I'm happy you're well informed. Like I said to you, appendicitis is an inflammation of the appendix. Everybody has an appendix, but when it gets inflamed, it's called what? Appendicitis. Okay, so because you're having appendicitis, the doctors are going to be taking you for surgery. And have you signed your consent form?
Yeah, I've done that.
Okay, you signed your consent form. What I will do for you is I'll make sure all the checklists have been completed. I'll have a look with your chart and make sure all the checklists have been completed. Is that all right?
Okay.
So are you urinating well?
Yeah, I'm urinating.
Your urine pattern is fine. You're urinating normally.
Yes.
And because you said you've been constipated for 5 days, I'll have a word with the doctors and see if we could start you on some laxatives.
Okay.
Although with appendicitis, sometimes a lot of people have diarrhea and some other people have constipation. But I'll double check with the doctors and see if there's any way we can start you on some laxative, probably before your surgery or after your surgery. I'll see what they think about it. All right. So can I just quickly ask you, how is your blood glucose? Have you been eating well? You know, because when you come to the accident and emergency department, we do like a blood glucose check on you. So what was your score? Your blood glucose, did they tell you there was any issue?
No.
They said it was okay. Because what I can see here, your blood glucose is 4.9 and that's quite all right. Okay. So for your disability, everything is all right. You know where you are in the hospital, and you know everything that has happened to you. So I'm more than happy you are alert and you're not confused. Okay. So I'll just move over to your exposure. I did take your temperature, and your temperature was slightly elevated. It was 38.1. So because your temperature is elevated and your pulse is quite elevated, it just shows that probably there's an ongoing infection. And it's a good thing we've confirmed your diagnosis that you're having appendicitis. So don't worry about that. We're going to be sorting you out, okay? So can I ask you, are you bleeding from any part of your body?
No.
Any rash on any part of your body?
No.
Any body temperature? Do you feel hot?
Yeah, I feel hot.
Because your body temperature was 38.2, you feel hot, okay? So don't worry about that. We are just in the process of sorting you out, okay? So what I'm going to be telling you now, because from the assessment I did on you, your pulse, like I said to you, was quite elevated, and your temperature was quite elevated, and that proves that probably there's an ongoing infection, and the doctors have confirmed you're having appendicitis, okay? So that gives you a new score of 2. And if you're having a new score of 2, what we'll do is we'll monitor you 4 to 6 hourly, and we escalate. Okay, so because your temperature is 38.1 and your pulse is 92, so what I will do for you is, and you're going for surgery, I'm going to be double checking with the doctors. I will come back and monitor you regularly. By right, I'm supposed to be monitoring you 4 to 6 hourly, but I'll come back sooner to check your temperature and see if it has gone down. I'll check your drug chart and see if there's any medications I could give to you, and I'll double check with the doctors if they are happy for me to give you a pain relief like an analgesic and something to calm your temperature, and probably a laxative, something to make you go to the toilet, because you really feel much abdominal pain, you know, because you are constipated for some time now. Is that all right? So before I do that, can I just double check with you? Do you smoke at all?
No, I don't.
You don't smoke at all. Do you drink?
No.
So how is your mobility before you started feeling pains? Do you mobilize on your own?
Yeah, I was mobilizing well. I can walk by myself, but because of the pain, I cannot walk by myself again. I'm always bending because of the pain.
So how is your nutrition pattern?
I was eating before, but now I'm not eating very well.
Oh, you were eating before, so you don't have issues with your nutritional pattern. So do you drink alcohol at all?
No, I don't.
You don't drink alcohol and you don't smoke. What about your sight? Do you use glasses?
No, I don't.
You don't use glasses, so you are all right. So you live with your partner from what I can see?
Yes.
And your partner supports you?
Yes.
So are you bothered about anything? Is there any concern you have for me?
No, I'm not. I'm just a bit confused because of the surgery the doctor said I'm going to do. So I don't know. I'm just quite scared. I don't know. I don't know if you can help me.
To be honest, I'm more than happy to offer help to you. When they tell people they are going to surgery, a lot of people are scared, but don't be scared at all. The surgical team is a very lovely thing. So what I'm going to do for you, immediately I'm done with you, I'll double check with the doctors if they want you to have any drug, because your pain is very high. After giving you an analgesic, and if they want you to have a laxative, anything they want, I'll give you. I'll make sure your checklist is completed. I'll hand you over to the surgical team. The surgical team are going to introduce themselves to you. What they do is they have an anesthetic in the team, they have the doctors in the team, they have the surgeon in the team, they have the nurses in the team. So every one of them will introduce themselves to you, and they will explain everything that is going to be done for you. So don't worry yourself, it's not a big deal at all. Appendectomy is a minor surgery, I have to tell you. It's not a very big surgery, it's a very minor surgery, right? So don't be scared. And when you get back from the theater, probably you may start eating immediately. Some doctors will say start with, clear fluid and and after a while you start eating. So don't worry about everything. The team is a lovely team, and I've had a lot of patients in the past who have gone for appendectomy surgery and they come back, everything is all right. Okay, so as soon as we get that appendectomy sorted, you see yourself mobilizing gradually, and we can also help you, and you can see yourself going back to the toilet the way you usually, you know, go to the toilet, and you will not be constipated. Okay, so don't worry, it's a lovely thing. Do you have any other concern?
No,
do you feel reassured?
Yeah.
You feel reassured and you are happy to go for the surgery, right?
Yes,
so what I will do, I'll double check to make sure all your checklists have been completed. All right.
Okay.
Do you have any other concerns for me?
No, I don't.
Are you sure you're all right?
Yes.
Okay, so lovely. So I'm done with you. I'm more than happy with everything I've done with you today. Okay. All I'm going to do now is see with the doctor if you can have some analgesics, some laxative, and I'll check to make sure your checklists have been completed. And hopefully I can promise you your surgery will all go well. All right.
Okay.
So thank you so much for your time. All right.
Thank you very
I will
much.
see you soon. Okay.
Okay.
So
thank you.
Do your hand hygiene. And guys, that's all. You can see assessment is very, very, very easy. So because of how easy the assessment is, I'm going to be giving you my own assignment for you. I want you to practicalize with this skill. So you can see everything about this patient is all right. The patient is going for an appendectomy operation. And you know, the patient was quite scared. I reassured the patient. I did the new score. And so it's very simple. So my assignment for you today is Mrs. Ellie Brooke presented into the accident and emergency this morning, post 10 days after surgery, with the complaints of weakness. Mrs. Ellie has had laparotomy done, and was diagnosed previously of ectopic pregnancy. She is now attending the surgical assessment post 10 days with a wound of 5 cm at the surgical site. The wound is inflamed with some exudates. Ellie is feeling very hot and tired than usual. She has reduced dietary intake and she's been constipated for 5 days and she's had abdominal pain. Her past medical history is she has a broken arm at the age of 5 and she is currently having hypertension and she's currently taking drugs for that. Her social history is she lives with a partner who is mobile. She lives in a 2-story building. She doesn't smoke, but she drinks occasionally, and she has no allergy. So guys, work on this and give me feedback on this. All right, so thank you so much guys for staying tuned. Remember to share my videos with your friends preparing for Osce exam. I will see you in my next video, and until then, keep passing your Osce exam, keep excelling. I love you all. Bye guys.